Hello everyone, this is David Davis. I'll be presenting ethical issues of drinking and alcohol abuse in the Navajo Nation as my final project topic. The community spotlight, the tribal community we will examine for this project is the Navajo Nation. The Navajo Nation, or Navajo land, extends into the states of Utah, Arizona, and New Mexico and covers over 27,000 square miles of the supreme beauty of the desert Southwest. Its territory is larger than 10 of the 50 states of the United States of America. The total enrolled population as of July 2011 was 300,000. Nearly half of these enrolled members of the Navajo tribe live outside this territory. The public health program. The public health program is to utilize and increase access to multi-based treatment and prevention strategies that will detoxify, evaluate, and stabilize adult alcohol abuse patients. We will plan to optimize success methods in treatment protocols, rehabilitation, and re-entrance to the community. We will attempt to tailor to the distinctive health issues and social related issues with alcohol abuse in the Navajo and Native culture, both on and off the reservation. Demographics to consider. This is a graph from an article from the U.S. government agency on substance abuse and mental health. American Indians and Alaska Natives tend to abuse substances, specifically alcohol, greater than other racial demographics. And you see from this graph that alcohol is higher, drugs are actually lower, but alcohol and drugs are higher than other racial demographics. Other demographics to consider. Most of the crimes that are committed on the reservation are alcohol-based, with alcohol being the primary cause or linked to the primary cause of the crime. In Navajo County, residents nearly 4 times more likely to die due to alcohol abuse than their resident states as a whole. Alcohol abuse is rarely solely about alcohol. Rather, the abuse is elicited and worsened by multiple etiologies. Other contributing factors in alcohol abuse to consider include moral and cultural values, individual and collective identities, perceived past histories, psychiatric or mental health issues, and social contention and environment. This public health program aims to increase access to multi-based treatment and prevention strategies that will detoxify, evaluate, and stabilize patients. It will optimize success methods and treatment protocols, rehabilitation, and re-entrance into the community. We will utilize standard flow of patient workup to stabilize patients and begin treatment algorithms that are utilized by the Indian Health Service. And this is one of the algorithms that is used by the Indian Health Service. The objective here is how to best optimize for Native American patients to see the links between the dysfunction and behavior with the physical, social, and psychological consequences. The initial arm of this study provides 3 critical components of community-based social detoxification, and these include evaluation, stabilization, and fostering the readiness for treatment entry. The goal is reducing the risk of physical harm and death during the detoxification process. We are thus partnering with the Indian Health Service to outline initial treatment protocols. The second arm of this study is a randomized control study. It provides alcohol abuse treatment through traditional American Indian values and ethics. This satisfies the need for tribally driven research and solutions. They will set and drive the research agenda rather than the researcher coming in with preconceived questions and solutions. It strengthens and maintains a cultural identity or belonging to the tribal community. The utilization of existing and organized community measures in the prevention of alcohol abuse will be utilized. It will maximize support of family and social structures for enhancing alcohol use treatment facilities' best success. And this is through incorporation of Native beliefs, incorporation of social and family structure. Next, a consideration of and utilizes historical and ceremonial events. And lastly, effective alcohol education and preventative programs in the past have focused on raising self-esteem, emphasizing traditional values, and healthy substitution. The second alternate arm to this RCT is Nutritional and Lifestyle Behavior Peer Support Program. This will serve as an alternative treatment through traditional AI values and ethics. The program outlining for enhancing culturally responsive methods and therapies to address alcohol abuse is fivefold. Number one, obtaining true and proper informed consent. This will require ongoing consent for both treatment and rehab arms of the intervention. This involves guarding personal information from public view. It obviously involves consideration of tribal expectations of both treatment and individual freedoms. Secondly, evidence-based methods as outlined by the Indian Health Services. Number three, tribal and community feedback. Communication with the tribe, communication to minimize and eliminate negatively stigma of alcohol abuse. Number four is health provider feedback, which is beneficence. It's necessary to maintain the trust in the provider-patient relationship. And lastly, public health assessment of the health improvements. The key partners and beneficiaries include the patient, patient family, the tribal community, the Indian Health Service, health providers, counselors, and the public health administrators and researchers. The primary beneficiaries of this would obviously be the patient and their immediate family and their support group. Although all parties play a role in the decision making in the treatment and ethics, the primary decision maker for ethics would be the public health administrators, the researchers, and more so the tribal community. This is the Indigenous Health Framework or table. It directs the forces and ethics of traditional research versus indigenous-based approaches. So looking at value principles, Western-based research and medical ethics versus traditional indigenous-based ethics and cultural approach. Next is power-based, cultural-centered research. Western-based focuses on statistical methods. It focuses on group effects, therefore the randomized control study. Indigenous-based would concentrate on historical, cultural, behavioral, and other norms. They focus on an individual balance to the community and the culture. The cultural perception and scientific expertise. Again, the ideal would be a randomized control study to test the intervention effect on a change in behavior. The healthcare advisory to implement these proven interventions versus the indigenous-based, which is tribal influence, to develop cultural intervention to prevent alcohol abuse, treat alcohol abuse, and rehabilitate. It focuses on community benefits. And lastly, individual versus group examination. Western tends to focus more on group statistical effects versus traditional tends to focus on individual, cultural, and community effect on changing behavior. We have several ethical issues to consider. Firstly, white and indigenous people both concur that alcohol abuse is a significant issue for the Native American population. However, they can differ on the causes and their approaches to combating that problem. Whites could stereotypically blame the Native American culture for the problem and thus advocate cultural revitalization to solve it. Native Americans purportedly blame the historical incursion of the white population and thus encourage cultural revitalization to solve that problem. And thus a separate symbolic and moral ethical universe exists. There are obvious social and ethical issues in studying alcohol abuse. This investigation redirects the use of tribal cultural tradition applied to the essential patient detoxification utilizing tried and true processes endorsed by Western medicine and the Indian Health Services. And it would be complemented with traditional medicine's established protocols to best focus and optimize treatment outcomes. The second ethical issue to consider would be alcohol abuse is linked to witnessing the imposed Western cultural change that was impacted upon the Native American culture. Native Americans view this as both a problem of alcohol as well as a subsequent help to be correlated with those solutions. And thus, in many ways, these new ways of life were imposed on them from the outside community. And therefore, is it ethical to perform Western medicine research in a substance abuse situation solely in a traditional Native American setting? I thank you very much for your time and attention. It's been good working with each of you over this past semester.